The challenges that pharmacies have been having. I noticed that Rite Aid filing for bankruptcy again. I don't know if there's any connection with the 340B. It's not a scandal, but a problem that is being looked at. And it appears that a bill to fix prescription problems and pharmacy problems in Oregon, House Bill 2385, the cure may be worse than the current disease that we have about this. I don't know if this is connected with what's happening with, Rite Aid, but, Rite Aid's been in trouble. But a lot of other pharmacies have been in trouble, too. A lot of local pharmacies have been in trouble. And I wanted to talk more about this with Leah Vukmir. She's a senior vice president of state affairs at the National Taxpayers Union. It's ntu.org. Leah, it's great to have you back on. Welcome.
Thank you, Bill. Thanks for having me on. Great to be back.
This 340B pharmacy issue, and we talked about it for a little while a couple of weeks ago. This is a growing issue. The 340B pharmacy was supposed to be something that was created to help people in really rough, I shouldn't say rough, but maybe low-income communities, a lot of poor people. It was supposed to help them get their prescription medications at a reasonable cost. Is that a fair way of describing what the intent was?
Yes, and great intent, and it's a federal program, which is key here when we talk about this. And it was 1992 for exactly those purposes, low-income, uninsured patients, giving them access to affordable medications. And, of course, we all believe that there are certain roles for government, and this is one where I think we could all agree, a laudable goal. And I am a nurse, besides having been a state lawmaker, and now in my role at National Taxpayers Union, I have a confluence of experiences to have a perspective to draw from. And I worked with families that were part of this program. So I know how the program started, and it was a good intention. But as things often happen with government programs, they morph either through unintended or intended consequences into something that is not what was the original idea of the bill. And in this case, the 340B federal drug program has morphed into a revenue generator for hospitals, large chain pharmacies, and pharmacy benefit managers.
Okay. Now, and you were also telling me, because I have your testimony you submitted to oppose the Oregon House Bill 2385. You're opposing this. And you had noted that this 340B program seems to be going to a lot of pharmacies in very high-rent neighborhoods or very expensive or wealthier communities, which it never was supposed to. Is that one of the side effects that's been going on?
That's right. Instead of serving the most vulnerable, there's been a proliferation of these pharmacies in more affluent neighborhoods. And there's a great study that was done by the Pioneer Institute, and they went state by state and looked at where these pharmacies are. And in what they found, that half of the 340B Oregon pharmacies are actually, almost half, are in affluent neighborhoods.
Now, let me ask you, when I say affluent neighborhood, could it be something as even as simple as, let's say, Costco pharmacy? Is Costco a 340B pharmacy? Do you happen to know by chance?
I don't know the answer to that.
Okay, because but if it were almost, given the cost at Costco and the way it's working out, it's not usually a poor person's place. You know what I'm getting at? See?
Right.
And that's what I was wondering. Yeah,
and the other thing that was noted in this report pertaining to Oregon is that 340B hospitals in Oregon provide less charity care than the national average, and that was one of the other parts of the original legislation, was that this is going to pharmacies or pharmaceutical manufacturers provide very deep discounts on medications to eligible providers, and then those providers are supposed to pass the savings on to patients.
But they're not passing the savings on to the patients. Isn't that right with these 340B programs? What's happening? Where's the money going?
Well, that's what we need to know. And those are the questions that state lawmakers should be asking. First of all, state lawmakers should not be trying to reform a federal program. There are some constitutional issues related to that, and I am, for one, a big believer in federalism and states, taking, the bull by the horns. But in this case, meddling in a federal program could actually cement to your Oregon state statutes some of the worst aspects of a federal program and make it much harder down the road to fix it, consequently hurting the very people that the program was supposed to help in the first place. And that's what gets me so frustrated when I see lawmakers, and this is Republicans and Democrats across the country. These bills like this are popping up everywhere.
And what is the House Bill 2385 designed to do? What does it do? What do you think is the dangerous part of it? Because we still have some influence. We can call up our state legislators, even on the Republican side, and say, hey, we don't want you supporting this. This is not a good deal. But we need to be able to say what's wrong with it. Could you help us?
Sure. What the program is doing is expanding the number of entities that can take in these discounts, and it's proliferating a bad problem, and meaning that there will be more and more of these 340B entities that will now receive these discounts and then not share it with the people intended to get the discounts. And so what we really need is accountability. And if the state lawmakers want to do anything, that's what they ought to do. They ought to start asking questions. It's just mind-boggling to me that a fiscal report was done on this bill by your number crunchers, the smart number crunchers, and I've worked with them in my state of Wisconsin, and I know they're smart people, but they are saying in their fiscal report that this bill will have no fiscal impact.
Well, if it's going to have no fiscal impact, okay, well, isn't the purpose of this to have a fiscal impact or not?
Meaning they're saying that it's not going to cost the state, but the problem is what happens is in your state employee health plans, it could have a huge effect. And let me just give you some examples that we've seen in other states. In Utah, the mandate was projected to cost the state nearly $2 million in lost drug rebates in just 1 year. And in North Carolina, 340B hospitals were charging cancer patients 5 times the cost of their medication, all the while billing state health plans. So here's where the cost comes in, billing them. And that's just unthinkable. In Minnesota, the data showed that hospitals netted over $630 million from the program.
Is this more of a Medicaid program? And the reason I bring this up is that Medicaid, when people hear that, we have to remember it's called Oregon Health Plan here. And
what I'm talking about is the extent of this program effect on state employee health plans and everyone else's. The Medicaid program has their own system. So this is a separate issue.
Separate, okay.
What we really need to get is accountability. And right now the bill just had a hearing yesterday in the Senate Health Care Committee. So people can start making phone calls, letting their legislators know the bill has bipartisan support. It's led by a Republican, but there is a Democrat who is also a sponsor of the bill.
Okay, who's the Republican leading it? Who's the Republican leading it? Do you know?
Yes, I had it right here in front of me. If you could just hold on 1 second.
Sure.
Representative Dial, or Diehl.
Oh, Ed Deal. Okay.
Yep.
Oh.
And there's also Representative Gamba, Gomberg, Javadi, and Pham.
Okay. So
they're the main sponsors of the bill.
All right. So Representative Ed Deal is the leader on this one. So you think this is actually going to make it worse, not better? Now, my question is there a law that the state could pass, for an example, that say, hey, listen, if there's a discount given, it needs to be given to the patient, the end user, or not?
Sure. What states could do is require that the 340B hospitals and entities report how much revenue they're earning from the program. Remember, they're getting these discounts.
They're getting the discount from the pharmacy company, right, from the pharmaceutical companies, right?
Yeah. So they could require that they report how that revenue is being spent. You could also require that the full 340B discount be passed to uninsured or cash-paying patients. Right now, there's no requirement to share those savings, even though the drug makers are providing the discount. One study showed that only 1.4% of 340B claims use discount cards.
Is there a possibility,
And pay the full
Leah?
price.
Is there a possibility, Leah, that they're trying to use these 340B pharmaceutical company discounts almost as a backfill for the hospital systems? And I bring this up because
bingo.
Oh, okay. All right. This was just a suspicion.
This is the big issue is that, why hospitals need to be held accountable.
All right. Okay. I'll tell you why here. And because last week, the state of Oregon reported that not even half of Oregon hospitals are profitable and making money because they're losing money on providing care. And when you talk about this going to hospitals and then they don't want to know where the money goes in the hospital systems, I think they're trying to look at not having to bail out the hospital systems. Providence hospital system just got out of a nurses' strike that I was talking about, and they haven't been profitable for, I think, over 4 years. And people say, well, they got all this money in this investment account. But I said, no, but they're losing money on actually providing patient care, right? And most of them are. And that's what's kind of scary. And is the state trying to encode like a backdoor bailout for them, which is not what the 340B is supposed to do. It's supposed to be going to people that are poor.
I don't believe that they're doing that knowingly. I will just say, and there are many hospitals and clinics that use the 340B funds responsibly, and they should be supported because that was what the original intent of the legislation was. But it's being pushed as our rural hospitals need the money. That's the big push. That's the big mantra that's bringing Republicans and Democrats to the table to support this. But if they really understood that those people in the rural areas are not actually getting the benefit, then perhaps they would scrap this bill and instead ask for more accountability. Ask the questions that need to be asked and say, how much is this going to cost the state of Oregon and our state health care plan, and what effect is this going to have on our taxpayers? Because those are the questions that should be asked instead of passing this off. And I'll be honest with you, a lot of times lawmakers will see that there's a bill that is being opposed by pharma companies, and they'll say, oh, well, then we must be, you
will knee-jerk in reaction to that and say no. If Big Pharma wants it, no. But they're already offering the discounts, right? We just want to be clear.
Yes, they are offering the discounts.
They're cutting the deals. They're cutting the deals for the hospitals and the 340B organizations. But it's what do they do with it? Because it's supposed to be benefiting the end user and especially people who are poor. And I would imagine also maybe cash payments, people who don't have insurance, right? Would that be fair part of it?
That's right. It's also for those who are uninsured. Although I thought we weren't supposed to have any uninsured with Obamacare, right, Bill?
I know. That's irritation for another day.
That's a whole other hour.
Okay. All right. Leah, I appreciate this. Do you mind if I share your testimony? I'll put it on my blog today so people can read it.
That's absolutely fine. And they can also go to ntu.org, National Taxpayers Union, to get more information about this issue and many other issues. We're out there supporting taxpayers. We support the little guys. We're the taxpayer lobbyists. And I love what I do. It's a great organization, and we're happy to help anywhere.
Leah, thank you for sharing that, okay? Be well.
Take care, Bill. Bye-bye.
Leah Vukmir from National Taxpayers Union. It's 8:30. This is KMED.